Welcome dear viewers to the video on OS and OT investigation. You might have come across these terms whenever you are working in the pharmaceutical industry and whenever you are learning. This video is regarding the investigations for out of specification, that is OS, and out of trend, that is OT. I have made some videos on these terminologies and these points. This video is a short video to let you know regarding the investigation for OS and OT. The pharmaceutical formulations are required to meet the quality parameters, and if there is any deviation or out of the specification results or out of the trend results, then we need to investigate it and provide the compliance. Understanding the OS and OT investigation in the pharma is very much important to every professional, and it is required for ensuring the quality and compliance in the pharmaceutical analysis. OS results means the results are outside the established specifications, and OT means the results are within the specifications but show the unusual trend. OT can be said when there are number of batches manufactured and you have a data pool. At least you have the data of 10 batches, and then you can say that the result is OOT or out of trend. In 2-3 batches you cannot say that the result is showing the OOT. So trend means you should have some trend data, then you can say the OOT. And OS means it is failing, it is outside the specification, so it is failing. Importance: key to maintaining product quality and regulatory compliance, and every OT is required to be investigated to ensure the quality and compliance. Out of specification means the test results beyond specified limits. For example, assay limit is 95% to 105%, and you are getting either 90% or 107%. Out of trend means the results are deviating from the established historical trend. For example, the assay values are within the specification of 95 to 105, but the trend values are around 98 to 99%, but this time you got 103%. This is just an example to make you know about the terminologies. Now, initial steps upon receiving the OS/OT. How you will do the initial steps? First is notify QC and halt further testing. Conduct initial assessment to confirm the results. Review raw data and the procedural adherence. First thing is to understand whether the test or result is showing OS or OT, and you need to notify the QC team to stop the further testing because there is a OS or OT. Then factor to consider in OS investigation. First is sample integrity, whether the sample was okay or not okay. Equipment calibration, maintenance, analyst error, environmental conditions, SOP compliance, historical data analysis. These things are required to be considered to know more about the reason behind OS. Then importance of GLP in investigation. Ensures reliability, traceability and consistency, maintains data integrity, helps in identifying issues effectively. If you come to a situation that GLP is not maintained, then you cannot rely on to that result of the batch or the result of the analysis. Then root cause analysis tools are there. 5 why technique, fishbone diagram is there, document analysis is there, and personal interviews are there. What had actually happened, and because of that the OS or OT is coming, that needs to be studied and the root cause analysis is required to be done. Then cross-functional collaboration will be there. It involves the QC, manufacturing, regulatory teams, regular meetings and updates, broader perspective, and aid root cause identification, because we need to find the reason behind the OS and OT so that in the next upcoming batches or products we can take care for the prevention. It will go into the kappa, corrective and preventive action. Then corrective actions: retrain the personnel if there is a root cause of personal training. Then equipment calibration enhancement, revision of the methodology SOP, enhanced monitoring of the protocol. These are some of the corrective actions. Then documentation and communication. So whatever you have find or whatever the reason was there, need to document all the findings and actions taken, ensure the audit readiness and transparency, and it is critical for the team alignment and the regulatory communication. Case example of OOT in stability study: observed a slow drift in potency, historical data analysis and trend plotting, collaborated with formulation team for corrective action. These are some of the examples. You can also consider your own examples, and then you go on finding the root cause. Then do the corrective action, document it, and then it will go for the kappa. Conclusion of the OS and OT investigation: these are important for safeguarding the product quality, require systemic, collaborative and well documented process, essential for regulatory compliance and patient safety, because the products should be safe and effective. Also, the product should retain the quality parameters throughout the shelf life, and if there is any deviation in the quality parameter, if there is any OS or OT, that is required to be investigated in detail, root cause required to be find out, and kappa required to be taken. All these things are required to be documented properly. This is the simple information to know regarding the OS/OT investigation. I hope this video will help you to learn these things and to get familiar with these terminologies. Thank you for watching the video.